good morning, or it's good morning in Germany, good afternoon in Jakarta. I'm very happy to see you in the seminar room. It feels almost like a normal lecture, just a few thousand kilometers between us. So as Ibu Dia said, I'm very happy that actually distance is no problem, that we can share this time together. I will spend about 30-40 minutes talking about management in health insurances. I discussed with Pak if there's anything which is unclear. I'm very happy to make a break or make an interruption at any time. So if terms are unclear, if language is an issue, or if you should explain something, we can do that at any time. And then we still have time also for a short question and answer session in the very end. Now, universal health coverage, and specifically the role of health insurance. That is what I will be talking about. And now I have to get my. There we are. By the way, the colleagues at UGM have this presentation, and Ibu Dia, Pak Lutfan, I think we will make this available to anybody who wants to have it. So if you want to forward my presentation to anybody who wants to have it, please do that. Now, universal healthcare is in relation, or is one aspect of the Sustainable Development Goals. I will start with that, and then we will talk about what it sort of in practice does it actually mean to run a health insurance. What are all the different tasks which a health insurance has to do, has to cover? That is the main part of this presentation. And point 4, specifically the role of IT. And the argument is that all the things which we discussed before, basically you need IT for everything. So you can argue that health insurances are actually IT companies or IT-driven companies. Since Dia has already introduced me, I don't have to do it myself. I just want to mention that for the last 10 years, I worked as a consultant in German health insurances, accident insurances, and I was very much involved in exactly the kind of projects or activities which I will be explaining to you. How do you manage business processes in a health insurance, setting up organization structures, setting up IT systems? That is what I did for the last 10 years before switching to the teaching side about 2 years ago. So a lot of it, what I'm talking about, is not so much sort of things you would read in books, but more things which you get in touch with when you meet with people in health insurances. But now, very generally, Sustainable Development Goals, I assume that you are familiar with these in general, and I don't want to go through them all. That is not my point. But there is this one point, number 3, good health and well-being. So that is one of the issues which the United Nations, all the countries in the world have said what we want to achieve. We want to achieve good health and well-being for everybody. Now, this again is a broad bundle of activities, and one of them is this 3.8. Achieve universal health coverage, including financial risk protection, access to quality essential healthcare services, and access to safe, effective, quality, and affordable essential medicines and vaccines for all. Now, I want to draw your attention to this aspect of financial risk protection. Financial risk protection, that is exactly what insurances do. We have insurances to spread the risk of the cost of health. So actually the Sustainable Development Goals don't mention health insurances. They only mention this issue of financial risk protection. Oh, where is it? Oh, there it is. But if you know what financial risk protection means, you know that you cannot do that. There is no way to do this without spreading the risks. And one way of doing this is a social health insurance. Now, this leads us to, well, actually, I want to move ahead to this. Now, I already said that I will focus on health insurance, but I want to just broaden the view at this point and make and point out that health insurance, of course, is not everything. I mean, you need other things. For example, you need healthcare institutions, you need hospitals, you need providers. Of course, I will not be talking about that today. I'm more talking about the health financing side and the how to organize the health insurance. But what you certainly need is political will. You have to have some kind of agreement in the country among policymakers, among the different parties, that financial risk protection and health insurance is important. And I added this word sustained. Sustained means for a long time. Health insurance systems are incredibly tricky. They are very, very difficult to organize. And if you want, there's not sort of you make one law and then everything works out. This is not how it happens. But if you look at insurance systems, they are reformed all the time. And this has to happen again and again and again. And that's why you need once, if it does not work at one point, it does not mean totally change the system, but reform the system, make it gradually better. And as a result, you will then have good institutions, good legislation, governance structures. For example, the relation between a Ministry of Health and a health insurance has to be clarified. Who does what? The role of provider institutions, provider organizations on the hospital side, on the doctor side. How is things organized? Who has what responsibilities? You have to be willing to redistribute economic resources. That is the essence of health insurance. Financial risk protections. Even if there is no health insurance, people spend money on health. So health insurance is not necessarily about spending more. It is rather about spending money differently, about spending it in a better, in a more efficient way. But all of this will not be enough, right away, if you don't have a well-managed health insurance organization. And that is basically what I will be talking about, is health insurance as a management issue. It is not enough just to say, and I know that I'm doing that in my teaching in Germany as well. We talk about different provider payment mechanisms. You have to decide, is it DRG, is it capitation, etc., etc. All these things have to be decided politically here. But after it has been decided, somebody has to do it, somebody has to run it. And that is where the management business of a health insurance comes in play. Somebody has to operate these systems, and that is exactly what I want to introduce you to. Now, if we say the role of health insurance in universal health coverage, here we have some of the tasks, and that is what I will be explaining more about in the coming minutes. Things you have to do if you want to achieve this universal health coverage or financial risk protection. You have to manage insurees, membership. People have to register on a basic level. The people who have registered have to pay contributions. So somebody has to make sure that contributions are calculated, that they are registered like in an account. Then we have providers, contract providers. You see here that what I'm introducing you to is the model of a social health insurance, where there's a split between the insurance and the providers. Dia, I am sure in your lectures you have this idea of a purchaser-provider split. So people will be familiar with that. But if you have a split between purchaser and provider, you have to have contracts. And it is the role of a health insurance to sign these contracts. Now, after health services have been provided, the providers want to be paid. So they will send a claim to the health insurance. So that has to happen. And there will probably be insurers who have special requirements for support, who need some kind of personal assistance, or who have just requests for information. So this also has to be done. So there are a lot of things, and again, I will elaborate on this in more detail, which have to be simply done in the most efficient way, keeping in mind that we're not doing this for 50 people, but we're doing this probably for millions of people. And we're doing this for all providers in the country. So, I mean, collecting the contributions for a few thousand people is no problem. Dia, how many people are insured in BPJS?
Around 180 million. So it's touching around nearly 80% of the population.
So that's what you always have to keep in mind. In health insurances, to a large extent, we have a problem of scale. It is just so many people. And that's why if this turns out to be inefficient, you don't have a small problem, you have a really, really big problem. Now, again, we will go into that more deeply. But at this point, of course, you need resources to do all that. I will not go into that too much today. You need contributions, the money to run the health insurance, and of course, the large bulk of the money will go into paying the providers. If you contract them, you will have to pay the claims. That is the main amount of money which you need. But of course, you also need funds for the internal operations, the staff of BPJS, the staff, the funding for IT systems, for buildings, etc. All of this needs money. You need staff, people to do the work of all the things which we have said here before, infrastructure, offices, and last but not least, information technology. And again, I will spend more time now on these different issues. Skip this. And in order to do that, I drew an organization chart of a health insurance. And this is generic in the sense that this is not one specific health insurance, but this is the functions of a health insurance. And you see here on the green level all the activities which I just talked about in slightly different words. Insurance service management, everything which relates directly to the insurers, collecting the contributions, contracting the providers, everything concerning the claims, and the internal management of the insurance. I have separate slides to go into more details for this, so I will just leave it. But remember that this is sort of how the puzzle fits together. Now, and we start here sort of on the left side with the insurance management. Now you see here, insurance management will, in almost any insurance which I can imagine, will include regional or branch offices, especially if you're looking at a country like Indonesia, which is so big, you cannot run the health insurance just from one office. You will have decentralized structures. Nowadays, very, very common, you will have a place where people can call, like hotlines. So you need a call center, people who actually sit behind the telephones to take those calls. even if you have a mandatory insurance, you still have to reach the people. You have to inform about the health insurance, the benefits, etc., etc. So you need some kind of outreach or marketing. And finally, most likely, you will need something like a case management structure where people who have special needs, maybe because they need so many different providers at the same time, or have long-term care needs or whatever, so to provide a special assistance structure for them, in addition to the assistance provided by the healthcare providers. So this would be what I would call insurance management or insurance service management. Now, to the left side, for all the different areas, I have started to put down 1 or 2 points which the government has to do. Keep in mind, we're not talking about a private company. We're talking about, in most likely, some kind of public company which operates under government guidelines. So it's not the BGS can decide everything on its own, but it is the government who sets the framework, and it's the same in Germany, and it's the same for any social health insurance. So here, on a very general level, the health insurance, the government would define the overall scope and structure of the health insurance, and it would be the role of the health insurance to provide different kinds of contact points. We speak of multi-channel communication. It is nowadays not enough just to have a branch office, but people expect call centers, they expect online contact points, etc. You have to inform the insurers about what they actually get, because it is a service institution. So it has to tell the people what are their benefits. And here in this part of the health insurance, there would also be the opportunity to voice complaints. Right? You can call the call center and say, the provider did not do the right things. I got bad service from one of your providers which you contract, or malpractice or whatever. So this would also be either be in the branch offices or in the call center, the place to voice complaints. Now, I collected some pictures. Dia will notice the green. The green is this color. It is the one of the main social health insurances, which is called AOK, which is used to be a regional social health insurance fund in Germany. And on the left side here, this is just actually different pictures of a service center. Typical counter, you see a fruit basket, and a person who would welcome people coming into this branch office and ask them what do they need, and she would send them to the different people like here sitting behind the desks, where they could sort of provide answers, change addresses or whatever. And here this would be an overall view of such a larger office space. Now, of course, every social health insurance, at least in Germany, we can talk about BPJS, will have a call center. So these are people who work behind the screens and who will answer on the phone. You can see here the headset, any request from insurers. I think that's quite familiar. The new thing for Germany is that all social health insurances are now providing online service centers, so that you can do many things on your own. You get, for example, if you change your address or certain claims, things. This is not very far developed yet in Germany. It is still being built up. So the number of things you can do online in Germany is still limited. Other countries in Europe are further ahead. But this is certainly, it will be the third big part. Okay, I have to speed up. I'm taking too much time. So this is customer interaction, contributions. As I said, you have to calculate them. Even if you have mandatory contributions, very likely you still have to calculate. Maybe it depends on family size, maybe if it is income related, whatever it may be, most likely you have to calculate contributions for a very large number of insurees. And then you have to keep accounts. You have to make sure that the contributions are actually being paid. And you have to enforce the non-payment of contributions. In a way, sometimes you have to go to people and say, please give us the money for the health insurance. And here I would also add keeping the records of the insurees. How about people who leave the country or people who die? Keeping the records, because everybody who is on the register presumably has to pay a contribution. So this would be the right place to also keep the records of who is actually insured. I will go through this very briefly. I said it could be income levels, the question of which sources of income. You have maybe people who have, for example, I am half employed and half self-employed. How do you calculate my premium? Family members, maybe you have different packages which you have to calculate. What do you do about arrears if people have not paid? Or maybe you have different population groups. How do you calculate premiums for seasonal workers who have a higher income for some months, but then they have a lower income after that? So the point I'm making here is that collecting the contributions for, as you said, the 100 million people is a huge task. And typically there are people in health insurances who do nothing but calculate contribution rates, answer specific questions by the insurees about how much do I pay, how does it work, and who follow up on this payment of contributions. So that is basically of the health insurance. We have to contract providers. Here I just wrote down from primary care, secondary, tertiary, pharmaceutical, others, assuming that contracts will look differently depending on who you contract. Primary healthcare, basic services, quite general. It's very difficult from spelling out the services for tertiary healthcare, maybe for a university hospital. Now here you need, of course, the decisions of the government on the provider payment mechanism. They would say, we're doing capitation for primary healthcare, we're doing DRGs for hospitals, and they would probably clarify in general the relation between provider and insurees, but the specifics of drawing up the contracts would still be an activity, a work of the health insurance. Now, for example, quality criteria, very important issue. It's not just, we all know that it's not just that you get a service, but we expect services in a certain quality, being the quality of the medical know-how, the quality maybe of the equipment, the quality of staff training, the quality of buildings. All of these things could be quality criteria in contracts. So, and the point is not to make the quality criteria as strict as possible, but to make them realistic. And so you have a good, also the health insurance needs a good understanding which quality criteria are important and which are actually doable. So it's about, this has to be feasible, this has to be manageable by the providers. The specific reimbursement criteria have to be spelled out in this. Now, this here would be the general on the political level, but the specifics in the contracts here written, signed between health insurance and provider. Volumes, how much can the provider actually provide? So, for example, in Germany, the main negotiation between insurance and hospitals is about this issue, about the volume of services which the hospitals can charge, can do for the health insurance. Documentation. The providers have to document what they have done, and only if they have documented in the right way will they get the reimbursement. And nowadays, more and more important, data security and patients' rights. So how are things documented? Where is data stored? Right to information, we call that freedom of information. All these things are also parts of the contracts. So you see, again, I talked about specialists before in contributions management. You need specialists for this. And you need totally different specialists for the contract. It's a totally different task. And it needs, for example, it needs more medical expertise, and it needs legal expertise. And here, once a contract is signed, that would be sort of here up for renewal, you have to see this as a continuous process. It is not that you write contracts once and then you're through with it, but this is actually a continuous, what we call a contract management cycle, that there is somebody who needs to write a contract, to draft a contract, then it is negotiated. In Germany, the negotiations between hospitals and the health insurances happen every year. This is every 12 months. They sit together and negotiate. Then somebody has to approve in the end. Now here, execution, that's real life. Services are provided. Obligation management, this is the providing the services and the payment. You see here, this looks like money. So, and the health insurance has to check if the provider fulfills his tasks. And then there might be reason to amend the contract, to change something. Auditing, audit the provider, audit all contract obligations. Like, you cannot see if at all times if the data security obligations are fulfilled. So you have to audit, and then basically things start again. So what I want to point out is that, again, a specialized task which requires know-how, staff, and continuous activity. So now you have contracted, and now you need to pay. Again, a specific task. Here again, I assume the government will probably define the provider payment mechanisms, and the definition of the benefit package is often political decision. In Germany, it is between health insurances and the providers. And again, a specialized task for different types of claims, depending on your provider payment mechanisms. The claims will look differently, they will have different information, but what you will always have to do is to check certain things. I will go to the next slide for that, because what I did was I just copied a very simple example. This is sort of a generic example of a claim. In this case, a fee-for-service claim in the German health insurance. And here on the top, you have the insuree. Now somebody in the health insurance has to check, is this Heike Testin, is she actually insured? Is she a member of BPJS? Maybe she is not. Maybe she has not paid her contributions or is insured somewhere else. Then on the top here, Max Mustermann, this is the provider. This is a doctor. Now, maybe this provider is not eligible. So you have to check, is this provider, is he contracted, or does he have a contract with the health insurance? This has to be checked. Then you have formal criteria. Rechnung is the German word for invoice, and you have a number here. So, and this is just an example. There are formal criteria which an invoice has to fulfill. Is this the case here? And then here, this is the actual medical part. So this has to be read, this has to be checked by somebody who actually understands what happens. Here's the diagnosis is bronchitis. So the question is, do the things which are the procedures which have been done here, do they fit to the diagnosis? Are they actually...
Sorry to interrupt you.
Yes.
I think it was disconnected. Could you please repeat in the probably the last sentence or the last minute?
Okay. I was talking about the different types of services which have been provided, and the things which have to be checked when the invoice is being verified, when the claim is being checked. And this includes, are all the procedures here part of the benefit package? If not, the health insurance cannot pay them. Do the procedures fit the diagnosis? So it could be that all the procedures in here are in the benefit package, but maybe they don't fit to bronchitis. Maybe while he was there, he provided some other service, but then it would not be eligible for reimbursement under this claim for bronchitis. And then the question: do all these procedures fit together? Maybe it's not consistent. So now you see, you actually need somebody with medical expertise to verify this claim. You need you don't need to be a medical doctor, but depending on the type of claim, you need medical expertise. For example, I know in the insurance institutions, which I know, there are specialists for verifying dental claims. Because if you know what procedures you need for bronchitis, you don't know how you reimburse a dental claim with different procedures. That is so different that you need a specialist for that. And just imagine this now being the DRG bill for a hip replacement. So this would be DRG figures, length of stay, all kinds of issues which have to be verified and checked. So you need medical expertise, and then you have to calculate on the right side, is the calculation correct? So you see there are always different factors. Well, maybe the provider can charge more for a certain procedure, or whatever it may be. So the calculation has to be correct, and that there might, in addition to that, there might be certain payment conditions, rebate, whatever it may be. So, and now imagine this, I'm again taking up Dia's figure, claims of 180 million people. So the challenge is not to do this for 50 claims. The challenge is to do this for millions of claims. And in order to do all of that, you will need internal management. Handle paper which comes in. I will talk about that in a moment. Financial management, personnel management, IT, and legal departments. And here, this is actually where you have to ensure efficiency. And all of these things change a lot with more IT. Let me go to the next slide. I might go back to this. This lady is operating on a scanner. So she is putting piles of paper, normally like between 50 and 100 sheets of paper, prepares them, puts them into this scanning machine, checks if the scans have been done correctly, and then all this paper is processed. The people, the staff get an image, a picture of this claim, and then work with that digitally. So this would be management of documents. This is archives. This is the old world paper. I would assume that you still have a lot of that in BPGS as well. Filing systems. Good fun?
Yes, yeah.
So this is the usual, what you see in branch offices in BPGS?
I think, yeah, probably later on the BPGS staff will can get comment also about this.
Okay. Maybe you remember, I don't want to go back all the way. Let's do that. What do you not see in this picture? Trick question. You don't see paper. So this is sort of the modern side of a health insurance, where in the service center, here the staff member would have the screen and have all the information. And also here, the people in the call center, they don't go collect files, but they would look on their digital files and access all the information. But until only a very few years ago, and in many cases it's still in place, we have a lot of manual filing, so you have to have staff to get those papers. But nowadays, you have the IT infrastructure to manage. So large health insurances are actually big IT companies which have to run IT systems, program IT systems to fulfill all their tasks. And I think that is a very important issue to keep in mind. Keep in mind 180 million people. And 180 million people submitting claims. So we're not talking if we just assume that maybe on average you have, let's say, 3 claims per person. Then we have around 500 million claims per year. And maybe one claim for a hospital bill has 10 pages. So we're talking about huge numbers of data, of documents, of transactions. And that is why IT is so important. And so the only way to handle that efficiently is to use IT. And the most important thing is this very first here, digitalization of inputs, so that the providers do not send claims on paper, but they actually submit them in digital form. And this is then, it actually saves a lot of work for the providers and for the health insurance. Again, would be an interesting question for the colleagues from BPJS. In many insurances, if you do not have digital inputs, you have people typing typing data from claims. So a claim comes in and you first have to input that into an IT system. And so you can actually save a lot of that work if you have digital inputs from the providers. More challenging, but also very important, is the automation of claims processing. Dia, I remember that we talked about that when I was in Jogja in February, that BPJS is also working on that as well.
Yeah.
Do you remember which process was that? I think it was processing of claims, right?
Yes, it's part of the business process in BPJS.
Maybe we can discuss about that later, because that is very typical that you start with one specific business process, a certain type of claims, and there you test this automation. And the idea is that all the things which I have indicated here, you don't have a person check, but you have an IT system check. The IT system check is the person insured, is the provider eligible, is this logical, is the calculation correct? All this can be done by IT systems, or at least a large part. What I showed you in the beginning, the online service center, that would be an example of self-services by insurees, where they can do certain things themselves, like changing an address, changing a bank account number, registering, and of course that would save resources in branch offices and maybe even save resources in in a call center, because people do things themselves. So you don't require a staff member to put something into the IT system, but the insurer does it him or herself. Now, in Germany, we have working examples of these top three things. The last part, automation of communication, is still very much new. I know of German health insurances who are testing this, who are having projects on this. You know chatbots probably like Alexa, where you can talk to an IT system. And in my class, I have a nice video on this. Maybe, Dia, I will send you the link. I have a video from I don't know if it is, I think it's Google, like a Google Assistant, which calls a restaurant. So you tell your computer, book a table for me at the restaurant, at the Chinese restaurant around the corner. And then the computer calls the restaurant and literally speaks with a person at the restaurant and reserves a table. And this is like a real conversation. These kind of things, they actually work now. They are very difficult. There are many challenges, like take different accents or take difficult words. And for that reason, I know that German insurances are very interested in that. The big ones are working on that, but it is not working yet. It's not operational. So now everything I discussed so far is within the health insurance. Now, for a very brief moment, we're leaving the health insurance and looking beyond. And this would be then digital health services. I just want to draw your attention to the fact that a lot of things are happening in the health sector, in IT, in digital tools, and that the health insurance has to be aware of that. It could be tools where you log on to check a diagnosis. You say, I have this headache, and whatever it may be, and then you put your information into a website, and the website might give you a diagnosis. So far, still not working so well, but it will be more and more important. Self-management of chronic diseases. The picture below I have here is an example of that, which is a combination of software and hardware. That's why they call it a bundle, a package, which is tracking of sugar levels, diabetes for diabetes, in combination with an app where you can share information with your medical doctor. The medical doctor has a very complete record, can contact you maybe right away if you have to change something in your medication or in your diet. So this would be self-management of chronic diseases, electronic patient records. And if I'm talking about patient records here, I don't mean just in a hospital, a file, but I'm talking about a lifetime record of medical procedures from primary, secondary, tertiary providers, all kinds of diagnostics, lab results, all of this in one file which is accessible to the patient. Now, again, this is something where Germany is not leading. There are other countries, like in Europe, for example, Denmark, or other countries, smaller countries, are very far ahead of us, but we are working on that in Germany as well at the moment to make this information available across the referral chain so that every provider has all information. Diagnostics by artificial intelligence, used a different subject, will not go into that. Telemedicine, basically what we're doing now, just imagine that I'm a medical doctor and one of you is a patient and we would be having a consultation here, same thing. Many benefits for the health system, I will not go into that. It will improve information flow, better access to information. So this is very beneficial. And again, the point here is that a health insurance has to understand these things and understand its own role. How do you reimburse that, for example? How do you reimburse an app on the smartphone? How do you ensure data protection? Many questions which are also relevant for the health insurance. But that is a totally different subject, so we will not go into that. Now, my final slide, conclusions. Yes, you need political will, financial resources over a long period of time to reach universal health coverage, but that is not enough. It is not sufficient. You need insurance organizations. And what I wanted to show you in this, I will go very briefly back to the full organization chart. Here. You need, if I talk about well-managed institution, health insurance institution, I mean well-managed in every single one of these little squares. So it is not enough if you say, we have brilliant contribution management, but you have very bad claims management. Or if your contracts are not good, not written well, forget about your claims management because the claims management depends on the contracts. Or if you have bad IT management, you might as well forget about everything else because everything you do here depends on IT. So if this square here fails, all squares will fail. Very similar to personnel management. If you have bad personnel management, it has a negative impact on many of the other points as well. But the point I was making about the big importance of IT means that this square, the IT management square, actually gets much more important. So you need organizational structures, business processes, and well-qualified staff in all these areas. That is the big challenge. And in the end, you will need very powerful IT system to handle all these activities. So again, keep in mind, I think because this figure is very illustrative, keep in mind doing all these things for 180 million people. And doing them fast. I mean, just imagine how long do you want to wait for a claim to be processed? How long do you want to wait for an answer to one of your questions? You want to have good access. And it's not one person who wants to have good access, it's 180 million people. And so when working towards this goal of universal health coverage, I think the resources required for managing the health insurance must also include IT. Not only, you need many technical skills as well, but IT is very important because otherwise it is very, very difficult, I would say actually impossible, to scale up, to process this very, very big volume of activities. Okay. Please don't hesitate to contact me. And I give back the word to Richard.